I feel like I used to deal with so many kids with really swollen tonsils, sleep apnea, just from getting sick all the time. And I used to always write down everyone's tonsil sizes at their checkups and all kinds of discussions about that. Tons of sinus infection, chronic. Sinus infection used to be a really big part of my pediatric practice. Allergies, eczema, asthma was huge.
You mean when you had more vaccinated kids?
Yes, way back at the beginning. Yeah.
And now you're saying you don't have many kids with that.
Asthma is I would say almost disappeared, not completely,
in
but
your pediatric
in my
practice.
pediatric practice, yeah.
And how many families would you say are in your practice right now?
Now we have about 15,000 registered in our electronic medical record. It could be maybe 5,000 of those are active, maybe I see them every so often.
And the rate of asthma right now is what, like 1 in 11 kids, 1 in 9, 10, 11, 12?
Yeah.
And out of 5,000 presumably active families, you're saying you see almost none.
Yeah, I see a little bit, but not like it used to be. I just remember my days were filled with prescribing inhalers and talking about how to treat your asthma and how to reduce your allergies and how to treat your eczema. And then after a day of seeing all those kids in my office with chronic medical problems, then I'd have 10 sick kids come into the office at the end of the day with ear infections and sinuses and, prescribing antibiotics only when needed. I was pretty careful with the antibiotics, but I feel like I was a super busy pediatrician and I so rarely saw someone and I could just say, oh, you're totally healthy. I didn't find anything wrong, and I was getting worn out, I would say. I mean, just the days were busy and I felt like, gosh, is this really what pediatrics is supposed to be like?
And these were families who were the ones that were vaccinating back at the start of your practice. They were still getting less vaccines than the typical family, right? Because they were following what used to be, I recall, you used to have an alternative schedule in your vaccine handbook that slowed things down, gave less vaccines, and they were still seeing more health issues amongst those vaccinated versus the unvaccinated.
Yeah.
Okay. So, all right. So for any of the epis or statisticians whose heads are exploding right now, maybe this could be an interesting point. And I don't know until I ask you. How many families does a typical pediatrician that follows the CDC schedule typically handle?
Yeah, you could see maybe 30, 40 in a day. In a busy office.
So for one pediatrician, now how many pediatricians are in your office?
It's just me.
It's just you. And you've got 5,000 families, you think, approximately, that are active in your right now. A pediatrician that is just following the CDC schedule, vaccinating, could they handle 5,000 families?
I would say maybe with a couple of nurse practitioners.
Just like you. You have any nurse practitioners?
No, I don't.
Okay, just you.
Okay,
so just you.
I would say no way. I feel like the reason I can have so many well children in my office, I think, is just because they never need me. They come in 2 or 3 times as a baby for checkups, and then I'll see them every year or 2 after that. I might see a small fraction of them 1 time a year being sick. There's so many kids I never see sick. And that's why I can handle so many. Whereas back when I first started, I would say my active patients were probably, I don't know, I would guess maybe 1,000 or something like that, because 20, 30, 40% of those are always coming in sick repeatedly.
Well, there's a deep irony to that, right? Because the whole point of vaccination is to prevent you from getting infectious diseases. Because what you're describing to me, a lot of them sound like one or other type of infection. But it sounds like the vaccinated kids, this one's going to be harder for the epis and stats to go nuts on.
Yeah.
But what you're saying is the kids who are vaccinated actually are presenting with more infections than the kids who have no vaccines, which is ironic given the whole point of vaccination is to prevent infections.
Exactly. I mean, the irony is quite horrific, I would say. I mean, it's fun to kind of smile about it, but if I'm right, then what we're doing in the whole field of pediatrics is like dead wrong. And it just blows my mind.
It's dead wrong in terms
irony
of patient care. It's dead wrong in terms of childhood health, but it definitely feeds into billing codes and more billing.